And I will also start sharing my slides. Today we have planned as an introduction to the project, first of all, who we are, what we are doing, and then we will also talk about our research. And Tanya Kim from Freiburg University will tell you more about the results and policy implications as far as we have come now to complete our publication. So just a second, I'll find the presentation in short. Here it comes back. I already did have it on the screen. So here it is. Just a second, I have to get back to it. Well, it does still show some slides on the side. I don't know why. Now it shows only for me. Now everything is functioning well. I hope the audience here in the room, you see well, even though I'm hiding some parts of the screen. Maybe if you want, you can move somewhere else. Yeah, my name is Ieva Reine, and I'm the project leader of our common project between the Baltic countries and Germany. And we proposed this project for some time ago, and we were so lucky to get financing from Hochschulkontor. And we are really happy that we can have this seminar today in Latvia. And I also would like to invite the head of the department, Hochschulkontor, to give us a welcome speech, Ieva Pranke. I hope you will give some welcome words to us before I start to tell about the project in detail. You're welcome. The camera. Yeah, good. Okay.
Yeah, hello, good morning, good afternoon. It's almost afternoon now, and it's my pleasure to welcome you all to today's seminar here in our office, and I hope you will feel here warmly welcomed. And yeah, I'm happy that the project was supported with funds of the Baltic-German University Liaison Office. And I'd like to very briefly to introduce you to the office, maybe also to your colleagues. Yes, our office aims to function as a scientific bridge between the Baltic states and Germany, and providing platform for scholars and scientists to discuss current scientific topics, like we are going to do it today. And through our annual project competition, we actively initiate and strengthen scientific collaborations between Lithuania, Latvia, Estonia, and Germany. And I'm pleased that the project team has decided to take advantage of this unique funding and to strengthen this collaboration. And today's event is significant as it presents a project that aims to generate insights that could shape policies for sustainable and inclusive employment. And I'm confident it will make a meaningful impact by providing practical tools and strategies that can improve the day-to-day working lives of employees across diverse contexts. And yeah, for that, I'm very pleased with our decision to support this project, and I would like to thank Dr. Ieva Reine and the whole team of the Rīga Stradiņš University, and also the project partners from Vilnius and Freiburg for your contributions and interest in international cooperation. And I'm convinced that this project will strengthen research capacities, and I wish that you will continue this productive collaboration. But yeah, now I think it's time for you to start all the discussions and presentations. So I wish you a productive event. Thank you for the attention.
Yes, so much. Thank you, the head of office, Ieva Reine, for this nice introduction to this seminar. And we will just make a small movement just to not cover the whole screen. But now I'll tell about the project more in detail. And here we have gathered after our first meeting in Freiburg University. Now it's Latvia's turn that we are able to present you already some results from our research. And as you mentioned, Ieva, and about the aims of the project that are really important for our societies, that we want to understand how different technological innovations and challenges and also societal norms have shaped the possibilities for different demographic groups to stay longer on the labor market, and how to foster that they are healthy on the labor market and also have environments that are kept healthy for everyone. As mentioned, 3 different countries are involved. We would have wished that even more would have been, like Estonia, but this time we did it together with Rīga Stradiņš University, and it's a renowned university focusing a lot on health and public health issues, and it oversees also the management of the whole project. I'm in charge of it. And also dissemination is being carried out mainly by Rīga Stradiņš University, but also with the help of our other partners. Then the University of Freiburg, there is an institute which has been our main partner. It's Freiburg Institute for Basic Income Studies, and this institute is represented by several persons who have been active in the previous collaboration before this meeting. And now we have our main partner, our principal investigator, Tanya Kirn, who is present here today. And you are focusing mostly on microsimulation models, as we in Latvia or Lithuania are not so familiar with econometric models, especially as regards health issues. We have been very happy to have you around us and transform our ideas into a more complex models that we have tried to develop together and that you have been more responsible for. We have also in your team, Tanya, several students, both your 2 doctoral students, a master student, and a professor. And Vilnius University is also very knowledgeable with 2 professors in psychology who have helped us to provide the base for developing health assessment strategy and to use it in the econometric models. And also knowledge in dynamics among different age groups as regards the demography has been very helpful from the side of our Lithuanian colleagues, as they work very close with us as regards share survey, and we have used the survey for the base of our research. So the timeline, we started in February this year, and we are soon coming to the end of this project, and 31st of October will be the final date. We gathered in Germany in May, and now we're here in Latvia in September. And we have collaboration partners who are assisting us during all the time. We have 10 direct participants in this project, of which 6 are senior researchers, 3 are doctoral students, and 1 master student from all the universities, 3 participating. And the final product of our collaboration is, of course, as being researchers, a publication, a manuscript that we are preparing right now and working hard on it. We have done it for the last several days. So here you can see the list of participants from each country. Some of you will recognize yourself. You are also participating here online. And we have several persons being present today, but some of you were here in Latvia just some days ago, and some of you have been also participating in seminars in Germany and somewhere else. What do we have to propose? First of all, we work on strategic recommendations because we have to benefit something from our research. We have to learn something from our collaboration. And we have very broad influences as regards the study population. We have different factors that impact the individual on the labor market. There are persons with different socioeconomic backgrounds. They are persons who have experienced different environments geographically and also being working in different geographical areas as, for example, dense populated areas or on the countryside. And of course, what is most important is to analyze impact on different groups. And here we have included different groups of populations that we want to pay attention to. And of course, gender issues, age, different aspects, and also if there are some health conditions should be taken into account. So that's why we have this project developed pretty complicated, and even though we have several months to run this project, we would really need more time to make additional analysis as we have experienced that we are seeing that we are finding a very interesting difference between our countries, and we would need to develop these issues even further. But Tanya will tell you about that a little bit later. Just to mention very quickly, because Tanya Professor will tell you a little bit later about methodology, microsimulation models that we have implemented, and there are several, and it's not always easy to find the best model. We have made a lot of different attempts to use these models, and they are always so complicated and at the same time so useful for implementing health variables in the econometric models. And Tanya Kern is so experienced in this sense, and she was so happy to assist us, and we are very grateful that you, Tanya, are eager to include our proficiency in health and public health variables and to combine them. And it's a very, very new approach, as to say. Here you can also shortly see our expertise. So Freebies' expertise is model development, and also to see how the societal change is happening, and also policy scenario testing. And Professor Kern has been doing a lot of research on retirement issues and really being very interested in how different aspects of life lead to retirement scenarios. And now we are trying to see also the impact of health and health behavior, health habits. And of course, we can't speak about one population in each country. We have so different traits in each population, both in Germany and the Baltic countries and other countries. So we have to take into account different health issues as well. And it means that it could be related to disability. It could be related also to inability to understand language, like migration and other marginalized groups. So what about the German-Baltic relations? We have been so close for many hundreds of years, and I'm also a descendant of Germans, just one part of Germans, but not completely. And I just feel that Germany is so close to many of us in different senses. It's not embedded only in our genes, but it's also language, our culture, education, herder school that was established in Latvia as a first school in Old Town, and so many different very important things that have happened in interaction with Germany. And that's why we feel that we really gain a lot of knowledge, and at the same time we understand each other in a very good way, that we can see and reflect what we have experienced during the historical times. But today we have different challenges that are similar, but some are different. And that's why we have to have these projects that we develop together. We see how our demographies have changed, and we have immigration, we have aging issues, we have economical issues, and a lot more. But we still think that we have to keep our collaboration, our partnership strong, that we can continue collaboration between our countries, different universities, and we are very, very happy that we can keep it and have some relevance that we can also present for our policymakers and tell about our findings that maybe will improve our societies, that we will have an opportunity to provide some more insights in what has happening and learn from each other, also from our projects. And our results are definitely interesting for researchers as well, not for policymakers alone. I will not go through project activities. You can see them very clearly. We have already done a part of it and almost coming to the final phase of the project. And we look forward to enhanced collaboration. We have been so happy to collaborate with Professor Tanikin and your colleagues. And we have also involved many other researchers from other countries, and not only Lithuania, but also we have partners from Estonia. And we are really looking forward to continued collaboration between Baltic countries and Germany. Yes, the next steps and invitation, we invite you to all other our seminars that will probably held on either internet or online or on in different countries. And please follow us on our home sites at Rīga Stradiņš University and also Freiburg University. We have information about the project. It's accessible. We also publish the news. And if you are eager to join the team, just let us know. We can also include other persons who would like to participate in this project, even though it's coming to the finish, but we can still continue collaboration. So sincere thanks to Hochschulkultur. We are very happy to be here at your office today. And I will give now the word to Professor Tanikin, so you can show the results of our study. Just a second, Tanya. Yeah. We have to find it now. It's not so quick. So which one should it be? No. It's no.
Do you have like the PDF or the file?
It's a PDF. It was here. Just a second. A short break. It's here it is. Okay. Do you need my help or will you manage? Okay. You just continue. Okay.
So, Ieva, thank you very much for the kind introduction. So, the slides are not yet visible. Ieva, may I have your help, please, to show the slides on Zoom? To show the screen, right?
Just a second. Oh, not the right one. This is the one.
probably only screen because it's there.
Yeah.
Perfect. Okay. Sorry. Well, what have we done so far, or what is our aim? So we would like to explore differences between men and women in the morbidity process. And in doing so, we want to explore how strongly they are driven by risk factors, for instance, smoking behavior, and how important are biological factors. That means how important is the gender component in that. And so, okay, this is a joint work between the participating universities in the network, between University of Freiburg.
Just trying to connect it.
Vilnius University, Rīga Stradiņš University, and Uppsala University.
Which one is?
It's the PDF here.
one?
It's this one.
Yeah.
This one. Okay, I'm very sorry for the technical issues that we encountered this morning. Okay, in the meantime, I can a bit talk about this. So we try to test the new approach. So this approach was originally developed in the context of labor economics, where the researcher tried to disentangle like the effect of characteristics, that means differences in labor market experience, and the return on those experience, that means the wages. In doing so, in the field of labor economics, the researchers were able to quantify the effect of discrimination. And but this is not what we would like to do in our research. We just would like to rely on this method and explore those differences in health outcomes.
Are you already sharing it?
I think important is that it is on
the Zoom, yeah.
On the Zoom.
And that's
Yeah.
fine like this, yeah.
Okay.
But it should be possible to also show it there.
Okay. Otherwise, just come around and join me, and then so okay. So let's continue with our motivation. So men often had lethal conditions like heart disease, stroke, diabetes, and women often had non-lethal but disabling conditions like arthritis, depression. And biological factors, they may explain the differences in vulnerability between those groups. But there are also like gender differences in lifestyle with regard to smoking, drinking, and inactivity that also affect chronic disease risk. For instance, men tend to smoke more often than women, or men tend to drink more frequent than women. On the other side, men tend to be more active than women. So we have like for both sexes, like positive and negative differences. So what the trends? So we all face demographic aging, which is related to rising demand for long-term healthcare and healthcare services. So the healthcare costs, they are rising faster than the aging rates. And there is a gender gap in health. So women live longer but spend more years in poor health and often require long-term care. We also observe country differences between Germany, the Baltic states, and we have also included Nordic countries in our analysis because with regard to per capita healthcare spending, it is highest in Germany, but Germany faces severe nursing shortages. In the Nordic countries, we observe a more resilient healthcare system due to early investment and preventive care, which seems to be a very important factor. In the Baltic states, we observe lower aging-related costs, but we face challenges in healthcare access and infrastructures. And this relates us or brings us to our research questions. So first, we want to explore how behavioral and physiological factors contribute to female and male differences in morbidity. Then we would like to quantify what is the relative impact of risk exposure versus biological vulnerability, and how to sex differences, how do they manifest in disability, functional loss, and how does it vary across countries and over time. So how do we like to do this? So what is our econometric approach? As said, our econometric approach comes from labor economics. And in this very simplified approach, we two OLS regressions are estimated and then subtracted from each other. For instance, OLS regression for men and women, we have as dependent variable, for instance, the health status, and as independent variable, we have differences in risky behavior measured as BMI, smoking behavior, drinking behavior, activity, and so on. And if we subtract those OLS regressions from each other, then we have on the left-hand side the difference in health outcomes. And this is explained by the first term, which is the effect of coefficients. And this reflects the differences in health status due to the, let me say, like the differences in the loadings. That means the differences in the regression coefficients. Short example for that, if we think about smoking behavior and its impact on health. So smoking causes more serious diseases for women than for men. And this will be captured in the first term of this regression. In the second term of this regression, we capture the effect or the differences in the observed covariates. That means differences in risky health behavior. As said before, men smoke more frequent than women, or men drink more frequent than women. But on the other side, men tend to be more active, physical active than women. So, and this approach allows us to disentangle the extent to which risky health behavior influence health outcomes or biological factors, or a combination of both. One challenge that arises from this is that this type of decomposition is traditionally used for linear models, but we work with count data, so the number of chronic conditions, and typically this follow nonlinear distributions, and so this type of decomposition needs to be adapted for those type of data. And there are, in general, 4 approaches available in the scientific literature. So the Oaxaca-Blinder decomposition could be extended to nonlinear models. We could also use a simulation-based method, which is called a fairly decomposition, recentered influence function decomposition, or zero-inflated model decomposition. With regard to those decomposition methods, the linear OaxaCa-Blinder decomposition is not suitable for count data, so we cannot use this. The other methods, they are suitable for count data, but the problem is with the nonlinear OaxaCa-Blinder or with a fairly decomposition, we would have to rely on simulation-based approaches, but we would like to prefer like a direct approach. So we test the reef decomposition and zero-inflated decomposition. And the zero-inflated decomposition seems especially promising because it handles zero excess data, which is, prevalent in our case. Just a brief, summary towards the reef decomposition. So this was developed by Firpo and its colleagues, and it's a two-stage procedure where in the first stage the distributional changes are decomposed into effective coefficients and effective characteristics, as described before. And in the second step, the two components, they are decomposed into each explanatory variable using the recentered influence function, which takes into account the different distributions, for instance, with regard to age or whatever, between men and women. This is how the recentered influence function is derived econometrically. And at the end, we can estimate the factor alpha, which is the regression coefficient, which is needed to quantify the effective coefficients. So another approach are zero-inflated models. And they seem to be very promising in our context because they account for excess zeros as we have in our data. And it is also like a two-step approach. First one, we have the estimation of we estimate the probability of structural zeros, and then the expected count among those risks for the non-zeros. And each part can be decomposed into the effects of characteristics and coefficients, which is similar to the OaxaCa-Blinder decomposition. So this is how it is done in those two steps, and how the counterfactuals are estimated. So let's have a first look into the data and into the results. We use shared data, and shared data has the big advantage that we can observe differences across periods of time. So there are several waves of shared data available. We can make cross-country comparisons. That means, for instance, between the Baltic countries, Germany, Scandinavian countries, and of course, we can observe or analyze differences in health outcome between men and women. So if we have a look at the first wave, this is the left-hand side, and the wave 8, this is the graph on the right-hand side, we see that the number of chronic diseases that the people have over, at different ages, at those different points of time, decreased significantly, because the scale on the left-hand side goes up from 0 to 3, and the scale on the left-hand side goes up from 1 to 0. So this is what we already observed, but of course, this is already known in the literature. Then we see if we have just a pure look by eye, a different structure between men and women. Men are always on the left-hand side, women are on the right-hand side. So based on this data, we have run a decomposition analysis. For instance, those are the results for Latvia. At the moment, those are very preliminary results, so we have to be careful with the interpretation. But we see that all the coefficients that entered or that are used in this estimation, that they are highly significant, and that we can explain and observe significant differences here within the country between men and women, and that we can disentangle the effect of characteristics and the effect of coefficients. We have run the same analysis for Germany. Again, we get significant results. Again, we can disentangle the effect of characteristics and the effect of coefficients. And if we have a look at the results and compare the results for Latvia and Germany, we see country differences. That means that the aging process in Latvia or in Germany is different because the effect of characteristics is different with regard to age. But also we see differences with regard to the relative importance of the BMI on the health status and so on. But we have, of course, further explored those results. Here we had we took a closer look in Latvia, and again we see the effect of coefficients and the effect of characteristics. We see, for instance, this is for women, and here we have contrasted a high outcome group and a low outcome group, and we see here this allows us to explore that the aging process between those different groups is different. So if we compare two persons with the same age, we see that that the risk of having a chronic disease is different, and that the impact of a higher BMI is different, and this allows us to draw further and refine conclusion with regard to the importance of prevention, but probably also with regard to importance of socioeconomic status, income, awareness about risky health behavior, and so on. So first, it's in fact it's too early to have real conclusions at this stage, but this paper that we are currently writing on, it provides a framework to decompose health differences in health status across gender, time, and countries. It allows us to identify and quantify the role of specific risk factors such as smoking behavior, BMI, physical inactivity, and so on, and their impact on health outcomes. We show that risky health behaviors have gender-specific health implication, and moreover, we can quantify the combined effect of risky behavior and biological factors on health. And this offers insights for the design of targeted prevention policies, which are very important with regard to the expected rise in healthcare costs. So some policy implications. So we have to take up measures to invest in workforce retention and to address nursing shortages. For instance, in Germany, hospital structures have to be improved. Gender-sensitive prevention programs have to be developed. In the Nordic countries, there should be a continuation of preventive care and digital health integration, and share best practice on aging and gender equity in health with other EU member states. And in the Baltic states, the healthcare infrastructure should be strengthened, especially the access in rural areas. And there should be also like public health campaigns to address gender disparities in health and as well as risky behavior. So that's it so far from our side. Thank you very much for your kind attention and for your feedback. If you have any questions, just let us know. So we would be happy to receive your feedback and comments on our research. So thank you. And yes, we are very proud that this research was supported by the Deutsch-Baltisches Hochschulkontor. And this had really a significant impact on our collaboration because it gave us the opportunity to meet in person, to exchange, to develop ideas, and just to start like new projects, papers, as we did in this case. So thank you very much to your side. So.
And for outlining our research, maybe we can stop sharing the screen, and you can stay here because we have many persons online. You see, pretty many here. And if you would like to have some questions to bring up, you are now free to comment or raise any questions of your interest that you just raise your hand and speak up if there's anything.
So, well, I would really like to to stress that those are very preliminary results. So this was just like a first attempt to transfer this method, which is not very common in public health because it's out of labor economics. So it's quite innovative, a bit unusual to proceed like this, but nevertheless, I think it's an interesting opportunity, and I'm an economist, and for me, is it especially interest to collaborate with you, as you are very experienced researchers in the field of public health, which is really not my domain, but I appreciate to learn from you and to exchange with you, and I think this is also for the Hochschulkontor a pretty interesting case to see how cross-disciplinary collaboration could create probably, hopefully, some new innovative work. As we like try to transform one method into another field of research. But as said, I'm not a public health expert.
Yeah, Antanas had raised his hand.
I just want to say that we are also from the
open.
Yeah. Can you hear me? Can you hear me, Ieva?
Here.
Yeah, that's okay.
Yes, we do.
Yes, sorry, I'll just disconnect this one.
Yeah, now can you hear me? No, still not.
Sorry, Antanas.
Can you hear me now? No.
So
Antanas, we can hear you. You can repeat the question.
I think those who are in person can hear me.
We can hear you.
You can, okay. So I have no question. I just want to say that we both from Vilnius University, me and Olga, are also very happy and very proud that we are able to collaborate in this project, and it is actually really interesting like meeting, like combining of both methodological expertise and also different ideas, and also shared database. So we are also very happy and very thankful for Hochschulkontrols to supporting this project.
So yeah, it's really a pleasure, and I'm really curious to work on this paper, because it's like a bit like a new venture to start and to test it. So yeah.
Okay, if there are no other remarks or discussion points, we would like to thank you all for involvement in this seminar, both on site and also online. If you would like to communicate with any of the research team members, you're very welcome. You have our addresses, I hope. Otherwise, you ask the Hochschulkontor. They can provide you with the necessary information. So thank you for participating in this seminar, and hope that you have learned something from our work that we have done. And those who are in our team, thank you so much for being with us, and for the common work that we are going to continue by the end of October. Thank you so much, everyone, and see you next time. Bye.
Thank you very much.
Bye. Thank you.
Bye.